You've had a coronavirus test, you know there's no forgetting it, but the future of testing is changing.
CBS 12's Madeline Montgomery shows us what doctors think it's going to look like.
Most people think getting checked for COVID-19 has to be an uncomfortable nose swab, but testing is getting more diverse. I'm actually here right now to get mine.
A swab in the nose, a swab in the throat, a swab in the mouth.
Different options to test for COVID-19 when just a few months ago there were none.
The testing has changed quite a bit, obviously, since this started. It was a novel virus, so there was no testing to begin with. We developed in the laboratory world antigen testing, which is the virus itself, and we developed antibody tests.
Antibody testing shows if a patient has previously had coronavirus. Because COVID-19 is still new to medical professionals, Universal Clinical Laboratories has had to grow and change to keep up with the pandemic.
So we invested a lot in infrastructure and in equipment to be able to participate in helping out with the pandemic.
They've now done 50,000 tests, and that number grows every day.
So what we've done is try to go to places where they don't necessarily have access to information or adequate health care to provide these services free of charge.
As the testing rate grows, the test itself changes and advances.
While the companies are working on the vaccines, in their trials, they're looking at what is the level that these patients have and which patients are not going to get the virus infection again after they get challenged having the vaccine.
That advancement could come in the next few months as vaccines become approved. In the meantime, the testing process can show if you actively have the virus.
That swab will tell us whether or not you have the actual virus on board now. Typically, after somebody is exposed, the virus will show up in the back of the throat in about 2 to 3 days.
Or if you've already had it through antibody testing. Once my sample is finished processing here, I should know by the end of the day whether or not I have COVID-19. From West Palm Beach, Madeline Montgomery, CBS 12 News.